Hello, I'm Dr. Paul Gilbert, board certified in emergency medicine. Today I'm here to discuss EZ-NG's revolutionary device that will allow for rapid bedside verification of nasogastric suction and feeding tubes. It can be done safely and effectively, saving time, money, and saving lives. My own experience and multiple studies have shown that the placement of NG suction tubes and feeding tubes is one of the most dangerous procedures in medicine. It is estimated that between 0.5 and 2% of the time, when placed, NG suction tubes and feeding tubes are actually misplaced. These misplaced tubes are a cause of significant morbidity and mortality. 7 years ago, a 21-year-old girl was brought to the ER I worked in after an overdose. A nasogastric tube was placed to evacuate stomach contents and to administer charcoal. Auscultation was used to verify placement. After the tube was thought to be in place, air was insufflated into the tube. The nurse thought a swoosh of air was heard and believed the tube was in the stomach. However, the tube was actually in the right lung, and 60 milliliters of activated charcoal was placed into the patient's right lung. Shortly thereafter, the patient stopped breathing, had to be intubated, and was placed on a breathing machine, spending a month in the ICU. The patient barely survived. This experience, as well as many others, prompted me to conduct my own research. In the literature, there were a myriad of published cases similar to the one I just mentioned. I discussed these concerns with my father, Dr. Robert Gilbert, who was board certified in gastroenterology. We then patented and developed a number of devices that will lessen the risks and costs associated with this dangerous procedure. Currently, many hospitals use only auscultation to determine if these tubes are in the correct place. This method has proven to be inadequate. In a published study in the Journal of Clinical Gastroenterology, auscultation alone was ineffective as a confirmatory test, with only a 6.3% specificity. A retrospective study was conducted of 9 tubes inadvertently placed into the respiratory tract. Auscultation by a nurse or physician failed to predict misplacement in 8 of 9 of the cases. Many hospitals have also realized that auscultation is as good as guessing when it comes to confirming whether the tube is in the correct place. Because of this, most institutions now require an X-ray to verify proper placement. This practice has been done for some time to verify feeding tube placement and is now becoming common practice with NG suction tubes as well. Though X-ray is considered the gold standard for verification, using X-ray has many drawbacks. It is costly, and it can also take a considerable amount of time. We believe that using pH to verify proper placement is the safest, most cost-effective way to rapidly check placement at the bedside. The only place in the body where the pH is below 4 is in the stomach. Therefore, if aspirate is below 4, then the only place from which aspirate can originate is the stomach. Studies show that if aspirate attained from the NG tube is below 4, the sensitivity is 100%. Based on this study, this means that if the aspirate is below 4, then the tube is in the stomach 100% of the time. According to a number of studies, aspirate is attained between 86% and 92% of the time. Based on these numbers, attaining aspirate and using it to verify placement can replace a costly and timely portable chest X-ray 90% of the time. If aspirate is not obtained, or the pH is not below 4, then an X-ray must be used. One may ask, why isn't pH used to verify placement more often? This method has been understood for a long time. There are many reasons that it is not currently used. Currently, no device exists that allows for testing of gastric aspirate without exposing the clinician to bodily fluids. Therefore, in order to test pH at present, aspirate would either have to be expressed into a test tube, sent to the lab for testing, or the clinician would have to express the aspirate onto pH paper at the bedside. Both methods can be time-consuming and both expose the clinician to bodily fluids. It is important to note that EZ-NG has not patented the ability to use pH for verification of placement. Instead, we have developed a device that allows for rapid bedside testing of pH and protects the clinician from coming into contact with bodily fluids. Let's review some of the benefits of using EZ-NG's pH indicator. It is cost effective. It is less than the cost of a portable chest X-ray to verify placement. It decreases patient turnaround time in the ER. It reduces patient exposure to radiation. It allows for rapid administration of charcoal in an overdose situation. It enables rapid feeding tube placement in locations where an X-ray is difficult to obtain, like a nursing home or a doctor's office. It allows for rapid bedside verification without having to await a portable chest X-ray. It allows for rapid checks of feeding tube placement prior to initiating feeding supplement, which can decrease aspiration risk. It decreases clinicians' exposure to bodily fluids. An aspirate pH of 4 or less is the most reliable indicator of gastric feeding tube placement, excluding radiographic confirmation. pH is considered more reliable than auscultation. It can be used to verify post-pyloric placement of intestinal feeding tubes prior to feeding.
EZNG's pH indicator can be used in 3 settings to verify proper placement. It can be used to verify placement of NG suction tubes. It can be used to verify placement of feeding tubes. And it can be used to recheck placement of feeding tubes prior to feeding. We will be reviewing how to use EZNG's pH indicator in these situations. First, let's review some limitations of the device. The specimen is estimated to be stable for 2 to 5 minutes at room temperature. If exposed to air longer than this, it may cause a change in pH. Contamination with blood will interfere with the reading. Bloody specimens should be read with caution, as it is difficult to interpret the color reaction. Interpretation of the test should not be done by one who is colorblind. This test is designed to be used by qualified medical personnel as an aid in professional diagnosis. Attention should also be given as to what medications the patient is taking. If the patient is on medication that raises the pH of the stomach aspirate, like PPI or H2 blockers, then the pH of the aspirate may not be below 4. However, in one study of patients that were on these medications, pH was used to verify placement 60% of the time. We will start by using the indicator to verify placement of an NG tube, which can be used for feeding or for suction. This process is used to confirm that the tip of the tube is in the stomach. Place the tube to the desired distance. Place the EZNG pH indicator on the proximal end of the tube. Place a 2-ounce syringe into the pH indicator. Insufflate 10 milliliters of air in adults, 5 milliliters in children, and 1 milliliter in infants into the tube. Aspirate stomach contents into the syringe. Insufflate by pushing in on the syringe to saturate the pH paper and cause a color change. View the color change on the pH indicator and compare to the color cliché on the indicator. If the color of the indicator matches the color cliché, then the aspirate's pH is less than 4.5. If the aspirate is less than 4.5, studies have shown that an X-ray may not be needed to verify placement. Verify pH of the aspirate with the chart provided. If the aspirate does not change the indicator to a color showing a pH of less than 4.5, then an X-ray must be done to verify placement. After the tube has been placed in the stomach and verified with a pH of less than 4.5 or an X-ray confirmation, advance the tube until believed to be in the small intestine. This is 20 centimeters in adults. Insufflate 1 cc of air for every 1 centimeter of tube and wait 30 minutes. Next, place a second EZNG pH indicator on the proximal end of the tube. Then, place a second 2-ounce syringe into the pH indicator and insufflate 10 milliliters of air in adults, 5 milliliters in children, and 1 milliliter in infants into the tube. Aspirate intestinal contents in the syringe. Insufflate by pushing in on the syringe to saturate the pH paper to cause a color change. Using the color chart provided, verify that the pH is greater than 6.0. This may indicate that the tube has moved in the small intestine and an X-ray may not be needed to verify its place. If there is not a color change to indicate the aspirate is greater than 6, then an X-ray is needed prior to use. For verification of intestinal location after feeding, follow these steps. Turn off feeding supplement. Flush the line with 10 cc's of water. Wait 30 minutes. Then place the EZNG pH indicator over the proximal end of the feeding tube. Next, secure the 2-ounce syringe over the proximal end of the indicator and insufflate 10 milliliters of air in adults, 5 milliliters in children, and 1 milliliter in infants into the tube. Aspirate contents into the syringe. Insufflate by pushing in on the syringe to saturate the pH paper and cause a color change. Verify the color of the indicator with the color key provided. A pH of greater than 6 may indicate that the tip of the tube is in the small intestine, and a reading of less than 4.5 may indicate that the end of the tube is in the stomach.
Using EZ-NG's pH indicator, rapid bedside verification of NG tubes and feeding tubes can be attained without exposing the clinician to bodily fluids. Studies have shown that this simple bedside test may be able to replace an X-ray 90% of the time. EZ-NG's pH indicator also allows for immediate, accurate placement of NG tubes. This will save time and money in busy emergency rooms by avoiding a costly portable chest X-ray to verify placement of NG tubes. It will also replace the multiple X-rays needed to verify the placement of feeding tubes. Thank you for taking the time to view this video. For questions or more information, please visit our website, www.ez-ng.com.